Hi, everybody. This is Katherine Marie, and you are listening to Long COVID Real Talk podcast. I wanted to do an episode about grief during the holidays, especially, and I also wanted to give you a mom update. So first, the mom update. My mom has stage 4 lung cancer, and she recently had surgery. She had a lobectomy, like part of a lobe of the lung was removed, and a partial pleurectomy, like the part of the pleura was removed. But then she developed a pleural effusion, which is like fluid in the lung, which is a pretty common complication of the type of surgery she had. So she started getting fevers, and she ended up having to go back in the hospital. They found loculations, like little, kind of like, I don't know if you've had boba tea before, but kind of like little bubbles that are separate. It's like the body takes the infection and tries to contain it. So she had all these loculations in her lung, and they put a chest tube in to drain it, and it wasn't really coming out. So they had to use TPA, which they use for strokes. It's a clot buster. And I believe the enzyme that they use is called Dornase. And they put it in through the chest tube and, let it go to the site and then have it drain. And it was very uncomfortable for my mom. She had a lot of pain, but she is doing better. The fevers have stopped. She was discharged on Thanksgiving and, on to the next thing, right? The other mom, because we have two moms here, we just got back from a trip back east. We were gone for 10 days. We got a call from my husband's family that my husband's mother, my mother-in-law, was not eating or drinking. So we were very concerned. And let me do a little bit of a backstory on this. My mother-in-law has a chronic illness that slowly has been taking her from us for 10 to 15 years. It is heartbreaking. They've been losing her bit by bit for a long time. Her husband is her primary caregiver. She's able to live at home because of all of his work. And she recently was not eating or drinking, so we heard. And she's having difficulty speaking, difficulty swallowing. She's just very tired. We immediately flew out thinking that we were preparing for a funeral. And we arrived, and my husband fed her breakfast that morning. And she ate the whole thing, and she was moving around and drinking and everything. So we think that she just had a bad day because another caregiver, the one that comes in every so often to give his dad a break, said that he did have a really rough day last week. So I think that is what precipitated the phone calls and all the concerns. And we just spent a lot of time with my husband's side of the family, and it's definitely something where, although it was not what we thought it was, we are never going to regret going there and spending time with his family. So his mom continues to slowly decline. I don't know, the prognosis is anywhere from a couple of weeks to a year or more. She's on hospice, though. And in my experience with hospice, with my own grandparents, my grandma was on hospice for weeks and weeks and weeks. And my grandpa was on hospice for a matter of hours. And we were all very surprised when my grandpa passed so quickly once he was in hospice. So you don't really know how much time you have when a loved one is in hospice. So my husband's mom is in hospice. We are anticipating her death. It's really, really sad. It's heartbreaking. Sorry, this is hard. It's hard to talk about. Okay, so that's the mom update. I wanted to do a little crash course in the types of grief because I find them fascinating, and because I think that once you know them, it helps give the feelings that you're having a more specific name, which to me is really helpful. So there are 5 types of grief. The first type of grief is normal grief. So normal grief is not pathologic. It includes the common feelings, behaviors, and reactions to loss. And these reactions to loss can include the following. They have physical, emotional, cognitive, and behavioral signs and symptoms. So physical symptoms: hollowness in the stomach, tightness in the chest, weakness, heart palpitations, sensitivity to noise, breathlessness, tension, lack of energy, and dry mouth. Emotional symptoms include numbness, sadness, fear, anger, shame, loneliness, relief, emancipation, yearning, anxiety, guilt, self-reproach, helplessness, and abandonment. Cognitive symptoms include a state of depersonalization, confusion, inability to concentrate, dreams of the deceased, idealization of the deceased, or a sense of presence of the deceased. And behavioral signs include impaired work performance, crying, withdrawal, overreactivity, changed relationships, or avoidance of reminders of the deceased. So it says that normal grieving may take months to years, depending on the loss, and that no one ever truly gets over the loss, but there is an eventual reconnection with their life, and they move on with their life, but their life has just been changed. Okay, so normal grief, not pathologic, can last for months to years, and it has a lot of somewhat severe symptoms, I would say, that are very interruptive for someone's life. So let's do the second type of grief. The second type of grief is anticipatory grief. So this one is grief before the loss. In my mother-in-law's case, the grief that my husband's family has been going through for the last 10 to 15 years has been anticipatory grief. Losing her slowly, not knowing how much longer they have her. Anticipatory grief is fear of potential loss of health, independence, a body part, financial stability, choice, or mental function. It's very common with terminal diagnoses because both patients and their family members can feel anticipatory loss. The patient anticipates the loss of independence, function, or comfort, and that can cause a lot of pain and anxiety if they're not supported appropriately. The patient may also have concrete fears, such as the loss of the ability to drive, live independently, or maintain their current body image. They may also have grief regarding anticipated family experiences or life events that they are not going to be able to be there for. And the family often starts grieving for the loss of their loved one before they die because they're envisioning their life without their loved one. Something interesting about anticipatory grief is it says that this type of grief has been shown to help cushion a person's bereavement reaction. I think it is really hopeful because when there is a terminal illness or something where you're anticipating the loss, it makes me feel like, well, that's good that at least the anticipatory grief has a purpose in that it helps later with the acute grief. Okay, number 3 is acute grief. Acute grief is immediately after the death of a loved one and includes the separation response and a response to stress. The bereaved person may be confused or uncertain about their identity or social role, and they may disengage from their usual activities and experience disbelief and shock that their loved one is gone. The fourth type of grief is disenfranchised grief. This is one of my favorite because learning about disenfranchised grief, once you learn about it, you understand why it can be a very difficult type of grief to work through. Disenfranchised grief is grief over any loss that is not validated or recognized. So these are people who have lost loved ones to stigmatized illnesses or events such as AIDS or suicide. Mothers and fathers may grieve over terminated pregnancies, stillborn babies, and finally loss of a primary relationship or the loss of a partner can contribute to disenfranchised grief because the individual may not feel that they are able to mourn openly due to the circumstances surrounding the relationship. Another thing that counts as disenfranchised grief is the loss of a pet. These are types of grief that are really, really severe and strong. Having experienced miscarriages, I totally understand that is disenfranchised grief and that it's incredibly difficult to process that grief because you'd feel like life just kind of moves on and there's no marker for it. There's not usually a service or anything like that to kind of help close the chapter in your mind. And the loss of a pet is one of the most difficult losses, I think, because your pets are with you 24/7 and, well, at least when you're at home. And, if you're used to sitting on the couch and your dog or cat usually sits in a certain spot right next to you, that's going to really affect you every day, when you sit on the couch, or if you're used to them greeting you when you come home or something like that. We don't get bereavement days for loss of a pet or for a divorce or the loss of a primary relationship. So if you're going through disenfranchised grief, I'm really sorry. It's really, really hard. And even though it feels like you are alone, you are not alone. And then the final type of grief is complicated grief. So complicated grief has 4 subtypes: chronic grief, delayed grief, when the grief reactions are suppressed or postponed by the survivor, either consciously or unconsciously, to avoid the pain of the loss; exaggerated grief that can include nightmares, delinquent behaviors, phobias, and thoughts of suicide; and masked grief, when the individual doesn't seem aware of their own behaviors that interfere with normal functioning as a result of the loss. So complicated grief is seen in 10 to 20% of individuals experiencing the death of a romantic partner, with much higher estimates for parents who have lost a child. Risk factors for developing complicated grief include sudden or traumatic death, suicide, homicide, a dependent relationship with the deceased, chronic illness, death of a child, multiple losses, unresolved grief from prior losses, concurrent stressors, witnessing a difficult dying process such as pain and suffering, lack of support systems, and a lack of faith system. Complicated grief may require professional assistance depending on its severity. Factors that contribute to complicated grief in older adults include a lack of support, concurrent losses, poor coping skills, and loneliness. So those are the 5 types of grief: normal, anticipatory, acute, disenfranchised, and complicated. I also wanted to mention for anticipatory grief that everybody, as they age, experiences a type of anticipatory grief, because as you age, your body is starting to become more prone to injury or illness. It takes longer to heal when things happen. You know the phrase that people use that youth is wasted on the young. It can be painful as you age to lose your youthfulness. So that can be anticipatory grief. Okay, so holidays specifically, I think are really, really tough for grief. I am a licensed social worker and a psychiatric mental health nurse practitioner. And when I used to work the suicide hotline, when I was practicing as a social worker, the suicide calls during the holidays would skyrocket. When I worked in the emergency department, there were a lot more people coming to the emergency department during the holidays for medical clearance to do inpatient psychiatric care. And, you think, why? Why would this occur? Well, I think there are a few things that contribute to it. One thing is social media and seeing pictures and images of a Norman Rockwell type family holiday season and feeling like your holiday season is not good enough or doesn't fit the mold of what you used to have or what you wished you had. Someone else's holiday just might look better than how you're feeling that yours is going. And there's a lot of comparison. There are also a ton of triggers. Like when you have grief, I'll go into this a little bit later, but no, actually I'll go into it now. I wanted to talk about how I experience grief myself. And one of the things that is really, really one of the main ways that I experience grief is attack grief. So like what happens is you are going shopping and all of a sudden a song comes over the speakers that reminds you of a loved one, or you take out an ornament at Christmas time and it's something that reminds you of a loved one who's no longer with you. There are gazillions of possible triggers during the holidays that can cause pain or cause a grief reaction, or as I like to call it, attack grief. Because the holidays are, well, they tend to be more emotionally magnified, and everything seems to have much more meaning than in regular life, and we feel this pressure to have a good holiday, like a good enough holiday. So let me talk about attack grief. For me, attack grief is like this. I'm on a surfboard and a wave comes and knocks me down off the surfboard and pushes me deep into the water. And I swim as fast as I can, as hard as I can to get up to the surface so I can breathe again. And the trouble is you're trying to figure out which way is to the air. You try to look for the sunlight, where the sunlight is. You're kind of disoriented because, the wave hit you really hard. And it's just like you're in a really weird place when you're first knocked over by a wave. And so you try to get to the surface and breathe again and get back on the surfboard. So at the beginning of grief, the waves are huge and they are frequent and they're strong, and they knock you off of your surfboard frequently, such that you feel disoriented a lot of the time at the beginning because of how frequently you are triggered. Your grief is triggered. So the thing that has helped me the most with the worst of the worst grief is simply the tincture of time. I wish there was something else I could say, but I don't have any other tricks or tips to get through it other than, learning coping skills and relying on your support network. And if you need help with either of those things, you can always hire a therapist to help you augment your coping skills and help you build a stronger support network. So that is how I experience grief. As time goes on, I notice that the waves are not as big. They're not as strong. They might knock me off my surfboard, but I'm really quick to pop back up, to the surface. Or maybe you just kind of lose your footing, but you're able to stay upright. And you notice that the waves are less frequent as time goes on. And the two main things I wanted to say, first of all, is that regular, just normal grief is not pathologic. There's nothing wrong with you if you're experiencing grief. Every person experiences grief in many different ways over the course of their life. And the other thing I wanted to say is just that no matter how bad it feels, I continue to tell myself that it's not going to feel like this forever. I never fully get over the loss, but life moves on and I move on with it, just in a different way. I don't know if you've noticed, but there has been a cat that has expressed a lot of interest in what I'm doing here, making this episode. I will introduce you to her. She is right here. She's very cute. She is someone that I got after I lost my dog, who was like a cat. And it took a couple of years before I was ready to have another pet. I would have wanted a dog, but my husband very rightly said, Katherine Marie, you don't have enough energy to walk the dog that we already have, let alone add a second dog. And I said, you are right. I do not have the energy to walk any dog, almost ever. So I said, what about a cat? And he said, yeah. So I found this cat, and she is beautiful, and she's a couple years old, and she has the same coloring as my dog did, who passed away. She's my little buddy. It helps with the pain of the loss of my pet that I had for, 17 years before that. So just a little story about an example of how moving on in the future sometimes looks different, and you still have the loss, but you can still move forward. I wanted to really briefly go over the stages of grief. I do not like the stages of grief. For the record, they are denial, anger, bargaining, depression, and acceptance. The reason why I don't like the stages of grief is because of how they are named. I think that it makes the person feel like they are progressing through the stages of grief, when in reality, they are more like 5 flavors of grief that you can experience at the same time. There's no progressing through it. You don't just stop being angry and go to acceptance. You can be in acceptance, and then all of a sudden you get a wave, a trigger, and you are angry, So all of these stages of grief are, they exist together a lot of times. There's no specific order for them. And unfortunately, it's not like a journey with a destination. Like, okay, here's what you do. Here are the stages that you go through. I wish it was. That would make grieving a lot easier. Anyway, thanks for listening. If you are dealing with grief this holiday season, I'm really sorry. It's really sucks. Feel free to send me an email or text if you need someone to talk to. Okay, and just as a reminder, if you're having any thoughts of harming yourself or others, or you're in crisis, you can call the suicide hotline, 1-800-273-TALK, or 1-800-SUICIDE. There's also a number you can text that is a suicide/crisis number. And if you're in crisis, you can also call the hotline. I used to work that hotline. It is staffed with people who are licensed mental health professionals, and they can help you determine next steps, or if you just need someone to talk to, they can talk to you. But you're not alone. So many people go through really difficult grief during the holidays. The last thing I wanted to say is, if you are interested in learning about how to do the holidays with a chronic illness, I did an episode with Dr. Zeest Khan, the physician who hosts the Long COVID MD podcast. I will put the link for the episode where we go through different things that you can do to make your holiday season survivable, if that's a word. So that's all I have for now. Thank you so much for listening, and we'll talk again real soon. Okay, take care. Happy holidays.